I've always enjoyed working with people directly. Medicine is one that's sort of unique in being able to really develop a relationship with a patient. Some of the conditions that we may be dealing with patients, they're going to need, long-term follow-up for a lot of these things. And yes, they become almost like a family member in some sense. Gastroenterology, maybe more so than some of the other medical subspecialties, really draws upon that background in internal medicine. You get a good mix of patients in the clinic setting, in the hospital setting, and then in the procedural setting as well. It's keeping people healthy too through colon cancer screenings and the like. So we're not always dealing with sick patients. A lot of times patients have no symptoms at all. It's not just the GI tract itself. We also take care of diseases of the liver and the pancreas and to a certain extent the gallbladder. I do enjoy taking care of inflammatory bowel disease patients. They certainly are a unique group of patients that have significant burden of disease that affects their quality of life. So if you can restore those things that we all take for granted in that patient, then it certainly is a very rewarding experience. Colon cancer screening is very effective. As it is now, only about 20 to 25% of the population who needs age-appropriate or whatever their particular circumstance is get that screening. And most of them are either fearful of the test itself or for one reason or another they may have heard some horror story about a colonoscopy. I always tell people that the worst part of a colonoscopy is the bowel prep the night before. And once you've done that, the hard part's over. Now we're getting to the point where we're getting to lower volume prep, so it's not the big 4-liter jug like it used to be. And what we're finding is that patients actually, they tolerate it better, leads to better patient compliance, and ultimately leads to better colon cancer screening. And in fact, most people leave the endoscopy lab thinking, when are we going to start this test? For a lot of patients with gastrointestinal disease, quality of life is a significant issue for them. And oftentimes, improving quality of life is absolutely our #1 goal.